Hi, my name is Mark Yodaiken. I'm an ophthalmologist in Manchester. In this video, I'm going to talk to you about the light treatment for dry age-related macular degeneration, an exciting new thing which is available. I'll start with a quick recap about the condition so that you understand where we're coming from. Light-detecting cells in the retina at the back of your eye send signals to the brain to be turned into images. Most of these cells are in a part of the retina called the macula. In age-related macular degeneration, cells in one of these layers of the macula are gradually lost, and so your vision begins to deteriorate. There are several things involved in the disease process. The first is toxicity and inflammation. Oxidative stress leads to a buildup of toxic byproducts in the retinal cells. This triggers chronic inflammation and further damage in the retina. The second is accumulation of drusen. Drusen are small yellow deposits that form between the retina and the underlying layer called the Bruch's membrane. They start out small, but over time they get bigger and disrupt the normal function of cells, causing further loss of vision. The third is pigment changes. The accumulation of pigment granules in the retina is another hallmark of dry age-related macular degeneration, and it indicates ongoing stress and damage to the cells. And finally, and most importantly, in advanced stages, retinal cells die, leading to geographic atrophy, the loss of areas of the central vision. When this occurs, it becomes very difficult to maintain normal life. Until recently, there was nothing that we could do to treat dry age-related macular degeneration. All we could do was advise lifestyle changes which might possibly help to slow the deterioration. But research has been going on for years looking for a treatment that can prevent or slow progression and reduce the risk of developing wet age-related macular degeneration, which is even more severe and progresses even faster. Now, finally, there's a treatment that gives real hope. It's known as light therapy, but the true name is photobiomodulation, or PBM for short. So what is photobiomodulation? It's a treatment that uses low-level light therapy to improve the health of the retinal cells. It reduces inflammation and slows the progression of the disease. PBM devices deliver specific wavelengths of light through non-invasive therapy sessions which only take a few minutes per eye. You wear a mask on your face and the light is transmitted to the back. The treatment process is straightforward and painless. Patients typically sit comfortably for a short period of time. Sessions are repeated over a series of weeks to achieve the full therapeutic effect. The systems are designed for precision and safety, so only the targeted retinal cells are stimulated and no damage is caused to the surrounding tissues. Photobiomodulation therapy involves the use of red, near-infrared, and sometimes yellow wavelengths to stimulate the mitochondria in the retinal cells. Yellow light also inhibits the formation of a molecule called vascular endothelial growth factor, otherwise known as VEGF. This molecule promotes the growth of new blood vessels, which can lead to wet age-related macular degeneration. Mitochondria are the energy powerhouses of the cells, and they are crucial for maintaining the retinal health. By boosting mitochondrial activity, photobiomodulation helps reduce oxidative stress and inflammation, both of which you'll remember are associated with the disease progression. Clinical trials using Valida and iLight systems have shown some very promising results. Here are some of the key findings. Number one, photobiomodulation therapy can decrease the accumulation of drusen. The deposits are the hallmark of age-related macular degeneration. Number two, some patients treated with photobiomodulation report better vision, with measurable symptoms in letters measured on the visual charts. Number three, PBM appears to reduce the risk of advancing to more severe wet form of age-related macular degeneration, providing long-term benefits. So, what does this mean for you? Photobiomodulation is an innovative, non-invasive treatment that has shown great promise in reducing drusen, improving vision, and slowing disease progression. PBM therapy is a breakthrough now in how we approach AMD. It offers hope not just for improving current symptoms, but also for protecting your vision in the years to come. As this technology continues to advance and become more widely available, I encourage you to discuss whether PBM might be suitable for you. It's not a cure, but it's a significant step forward in managing the disease and maintaining your quality of your life.